Dr. Deitrick is an assistant professor at the University of South Florida, and she's also a faculty member of the Florida Caribbean AIDS Education and Training Center. She has more than 30 years of healthcare experience, spending the last 13 years as a nurse, educator, researcher, and writer. Dr. Deitrick has developed and presented educational sessions for topics on HIV. She has spoken at national conferences and previously prepared 2 online educational modules for hospital staff. In addition to her wealth of knowledge and clinical education experience, Dr. Deitrick has published 25 peer-reviewed journal articles. She holds a doctorate in applied medical anthropology from the University of South Florida. Thank you, Dr. Deitrick, for the presentation.
Okay, thank you. I'm going to, we'll go ahead and start now. These are the objectives for the session. At the conclusion of the session, all participants should be able to define health literacy, describe how language and culture affect health, discuss effective communication strategies to help determine a patient's level of health literacy, and identify tools and resources that can be used in the clinical setting to promote health literacy. Let's begin by talking a little bit about literacy. When we talk about literacy, we usually define the term based on a person's ability to read. As you can see, literacy is actually more than reading alone. It encompasses reading, speaking, computation, and problem solving. The important thing to remember is that a person may have limited or low literacy skills in one or more of these areas, but this does not mean they are illiterate. It's often hard to tell if someone can read or not, since many people will say yes they can read even if they can't due to stigma. It's important to look for signs. The first step is to identify patients who are functionally illiterate. And functionally illiterate means that they're unable to read and unable to understand how to take medications or when to come in for a follow-up appointment. You can't depend on appearances. Many well-dressed, even articulate patients have literacy problems, and you really won't see illiteracy unless you look for it. There are some fast, easy ways to help confirm your suspicions that a patient may have literacy problems. One doctor I know said that she carries a pill bottle with her. She said she takes it out of her pocket and asks the patients to read it and tell her how they would take medication. And if they stumble, then she knows that she needs to communicate very clearly with anything during that visit. Another technique is to tell your patients you want to test their vision and ask them to read a few sentences from a pamphlet. If they give you the age-old excuse that they left their reading glasses at home, be wary. And here's the definition of health literacy. You can see that health literacy refers to the ability to obtain, process, and understand health information. Think about it. Many people can read and write at advanced levels and still have trouble understanding health information. This makes health literacy an important clinical issue. People who have difficulty navigating the healthcare system for whatever reason may not get the care they need. Health literacy is much more than being able to read. It is being able to understand and use health information. Even well-educated people may have problems with health literacy. Health literacy can include basics such as not knowing the correct names of body parts, to being able to read a food or medicine label, to being able to measure blood pressure or blood sugar. Often we find patients in our HIV clinics who do not know how to read a prescription label, how to request prescription refills, or don't fully understand the plan at the end of the visit. All of these examples will be addressed in today's webinar. It is important that we verify that all of our patients fully understand their health issues and treatments. Don't assume they understand just because they may nod or say okay. It is embarrassing to admit that you don't understand written or oral directions or information or don't know what a word means. Clinicians should assess their patients' understanding of HIV, modes of HIV transmission, modes of prevention, etc. We have found that patients have very different ideas of what it means to have HIV depending on their age. HIV can be complicated, and even those patients who are highly educated may forget or not understand information. Never assume a patient understands. Furthermore, science can be scary for many people. Many people might not know medical and anatomical terms, even if they are fluent in English. You'd be surprised how many adults still use words like pee-pee to refer to their private parts. Here are some quick facts to keep in mind as we discuss health literacy. And the first fact is really alarming and shows the need for training such as this. 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. Think about it. That means that we really need to understand health literacy and understand some of the information and tools and techniques that I'll be giving you today in order to really help our patients improve their self-management of their disease. Health literacy can impact health status in a number of ways as indicated on this slide. Note the last point. People with health literacy issues tend to use treatment services more and prevention services less, which means they can have difficulty self-managing their health. It's important for us as healthcare professionals to help people become more health literate so that they can self-manage their care and become healthier. Many factors impact a person's ability to obtain, process, and understand health information and services, including some of those listed here. Cultural differences play an important role in this. Some cultures have differing ideas about disease causality, such as spirits or evil eye or punishment, which can impact a person's understanding of health information. Because of the increasing diversity of our patients, we need to understand aspects of culture and language and the impact of culture and language on health literacy and health. So I'm going to briefly review those before we move on. So let's briefly review. As you know, culture can have an impact on health and health literacy. There are many definitions of culture out there, but I like this one because it's easy to remember. Culture is the things that bind a group of people together. Geography can play a role as well. People from the same area or same country may share some or all of these components, but not always. There are also organizational cultures and professional cultures such as medicine or nursing, each with its own customs, languages, beliefs, and traditions. And it's culture that distinguishes us from our closest relatives, the great apes. Culture influences many aspects of people's lives, including health. Disparities refer to differences between people. These differences can affect how frequently a disease affects a group, how many people get sick, or how often the disease causes death. Some of these disparities include things such as understanding of and priority of health and illness, the way people interact with a healthcare system, health-related choices and decisions, individual participation in programs of participation and health promotion, access to health information and services, help-seeking behaviors, and adherence to treatment. Health disparities can be magnified based on some of these things. Culture can also impact both personal history and wider situational, social, political, and economic factors. It's important to consider culture when discussing health literacy. Another concept that's going to be useful as we discuss health literacy is the concept of worldview. Worldview is important because we were all brought up in one culture or another. Worldview doesn't change. This is the basics of what we believe. Worldview impacts how we see the world and make judgments. It also impacts our understanding of health and illness based on the cultural constructs about health that we were raised with. The concept of lived experience is important to keep in mind when we talk about worldview. One needs to experience something to really understand. As an example, let's use HIV. Unless you've experienced the stigma of HIV, it's difficult to understand what people living with HIV are experiencing. The language you speak at home impacts your view of the world. For example, if you speak a language that has words classified as masculine or feminine, this can impact your views on gender and conceptions about gender. Language can also be a barrier if we don't speak the language of those around us. This is a major problem in our country. We have lots of people who speak different languages who may not be proficient in English. Similarly, there are professional languages such as the language of medicine or science, etc. For people who don't speak medical, for example, the language and words can be a mystery. Think about how this can impact us in our work. Language can create barriers for people seeking health care, among other things. Language is a key aspect of health literacy. When we talk about language, we should also talk about communication variations that impact communication and are thus important in our understanding of health literacy. For example, personal space. That means the culturally acceptable distance between people when talking. Think of being in your face. In some cultures it is accepted to stand very close when talking, others less so. Similarly with eye contact. In some cultures it's considered rude to make eye contact, especially between women and men, professionals and clients, and doctors and patients. This has to do with deference and modesty in some cultures. Same thing with touch. It's acceptable in some cultures, not in others. Same thing with time. In some cultures, people are casual about time, and that can result in being late for appointments. Also, you have things like gender norms. This includes things like female modesty, chaperones, males taking care of male patients, females taking care of female patients, and the like. And then hand gestures, which are often overlooked. Things like thumbs up, okay, and pointing, among other hand gestures, are considered rude and even obscene in some cultures. So you have to be very careful about using hand gestures when you're dealing with your patients. Limited English Proficiency, or LEP, is a major barrier to healthcare access for people in our country. Health information needs to be communicated plainly and in the language of the patient. We'll discuss ways to do this later in this session. When discussing limited English proficiency and health literacy, we should take a look at this map. As our country becomes more diverse, more and more people speak a language other than English at home. If you look at this map, you'll see that there are many areas of the U.S., and that's the colored areas, where English is not spoken at home. This means we as health professionals need to be aware of the possible language barriers that may exist with our patients and work to ensure that such barriers do not affect a person's understanding of and access to health care. A key point when we talk about health literacy is that a person's native language is usually their language of choice when receiving medical care, even if they are bilingual and appear to be fluent in English. If a patient is bilingual, ask them what language they prefer to use for communication about health issues, and then act accordingly. Now that we know the basics about health literacy, let's talk about how to make the healthcare setting more user-friendly for everyone. Everyone will appreciate a healthcare environment in which information is presented in a way that is clear and easy to understand. So why do we need to promote patient health literacy? Because it impacts the ability of us to access care and to work towards achieving optimum health. And you can see that it includes patients' ability to share personal and health information, to engage in self-care activities and chronic disease management, to act on prevention information, and to adopt health-promoting behavior. One way to help minimize barriers to health care related to health literacy and language is through the CLAS standards. Health inequities in our nation are well documented, and the provision of culturally and linguistically appropriate services, or CLAS, is one strategy to help eliminate health inequities. The CLAS standards were developed by the government as a blueprint or guidelines health facilities can use to make their facilities and staff more welcoming and accessible to patients from diverse backgrounds. This is a whole separate topic that I'm just going to briefly discuss so that you know the basics, since the CLAS standards are important guidelines in developing a welcoming clinical environment. By tailoring services to an individual's culture and language preference, health professionals can bring about positive health outcomes for diverse populations. The provision of healthcare services that are respectful of and responsive to the health beliefs, practices, and needs of diverse patients can help close the gap in healthcare outcomes. Think of the CLAS standards as a blueprint for implementing culturally and linguistically appropriate healthcare. The CLAS standards provide a blueprint to help healthcare organizations develop systems and processes that will enable them to better serve patients from diverse cultures. Implementation of the CLAS standards is essential in order to effectively respond to issues related to quality of care, changing demographics, the marketplace, disparities, legal mandates, and liability risks. The key word on this slide is partnership. CLAS standards encourage organizations and individuals to work together with their patients and communities to create a linguistically and culturally sensitive healthcare environment. So the CLAS standards are organized around this principal standard. And you'll notice in this principal standard that health literacy is included, as well as communication. So today we'll discuss those standards that involve health literacy and communication. The specific CLAS theme that involves health literacy is theme 2, which deals with communication and language assistance. And you'll see here that these themes include things such as providing an interpreter, providing written explanations, providing certified or trained interpreters, and providing easy-to-understand print and multimedia materials and signage. So number 8 is the standard that really is important in our discussion today, but we will be touching on the other ones as well. As we've discussed, culture and language are key aspects of patient satisfaction with care. The CLAS standards were developed in order to provide guidance on how to improve access to care for everyone, regardless of their country of origin or native language. Next, we're going to talk about specific aspects of the health environment and ways to communicate more effectively with all of our patients. This chart illustrates how important it is to communicate effectively with people at every point of contact. Speaking the same language is not enough. You need to ensure that the understanding is the same. Think about your work setting and how effective communication might be enhanced using this chart as a guide. Remember that many professions have their own language, particularly medicine. Do not use medical jargon when talking to patients. Don't assume they understand. Just because they nod their heads or appear to be listening doesn't mean that they get it. As part of effective communication, it is essential to understand that many people are anxious, worried, and afraid of going to healthcare settings. Even those who are professionals themselves can have difficulty communicating when they're in the patient role. You might want to use methods such as a secret shopper to traverse your workplace from door to door to see what you encounter. This can provide insights on what might be needed in order to enhance communication in your workplace. As noted earlier, language is an essential aspect of communication. Language barriers can result in problems such as misdiagnosis, non-compliance, medical errors, longer hospital stays, more complications, and the list goes on and on. Offer and provide language assistance services, including bilingual staff and interpreters, at no cost to each client or consumer with limited English proficiency at all points of contact in a timely manner during all hours of operation. Ensure the competence of language assistance provided to limited English proficient clients and consumers by interpreters and bilingual staff. Just because someone is able to speak a language doesn't mean that they know the correct words for medical terms in that language. Family and friends should not be used to provide interpretation services unless requested by the client. While face-to-face live interpreter services are ideal, This isn't always possible. Telephone interpreter services, also called language lines, can help bridge the language needs of patients. While these telephone services are not perfect, they are helpful when a live interpreter isn't available. It's important when using these lines to be sure to ask for a medical translator. Telephone interpreter services may be the only option in facilities that are very decentralized or must deal with a large number of languages. Telephone interpretation may be available for non-clinical interactions, emergency situations when waiting for in-person interpreters may compromise patient outcomes, or in situations requiring very uncommon languages. Video interpretation systems are also available and can be especially effective for communication with patients who are hearing impaired. One often overlooked aspect of health literacy is wayfinding, or navigating through the healthcare facility, including the parking area and the building. Many people have difficulty reading and using maps and signage, making it difficult for them to find their way around a health facility. This is especially a problem in large medical centers and health complexes. If you look at this map of USF, you'll see what I mean. The print is really tiny, and for someone who has issues being able to read a map, you can see that it looks like nothing more than a bunch of black dots, silver dots, and a jumble of teeny tiny words. It's important to look at building directives, directions, and signage inside elevators to see if these are clear and need to be improved. Difficulties with wayfinding can lead to anxiety, embarrassment, and lateness to appointments. So if you have a lot of patients who are late to appointments, think about whether navigation or wayfinding might be an issue to consider, and maybe it's something you need to investigate. And think about it. Do you think a patient will be focusing on what a provider is saying to them when they are anxious about whether they can find their way back to the entrance of a building or to their car? And speaking of navigation, here's an interesting fact that you may not be aware of. Floor numbers can be confusing, especially in elevators. In some countries, the ground floor is considered the first floor, while here in the U.S., the first floor is usually the floor above the ground. So imagine being from a country where the first floor is the ground floor, getting into an elevator and thinking, well, if I'm on the first floor, why is there a 1? And we've had more patients in some facilities I've worked at lost or confused because they didn't understand that the ground floor is not the first floor. So it can be very confusing, and think about how a patient might get confused. And I would suggest that you do a walkthrough of your building with a critical eye and a camera and invite someone who has never been there to walk with you. Look at the signage, look at directories, look at elevators, and identify and take pictures of barriers that need to be addressed. You might be surprised at what you find. As I noted in the previous slide, health literacy also involves the ability to navigate through the healthcare system. This includes being able to find one's way around buildings such as hospitals and clinics. This slide has pictures of universal health symbols that have been developed to help people navigate in the healthcare environment. A picture really is worth 1,000 words. In healthcare, it is important to remember that many people, regardless of their ability to speak or read English, have difficulty understanding medical terminology such as radiology, phlebotomy, cardiology, EKG. It's therefore important to use symbols whenever possible, along with medical words such as pharmacy or radiology, to help people navigate through your facility. And one facility that I worked at was doing just that. They were using these symbols. They were putting these symbols and then putting the corresponding word with them to really improve the navigation. And I will tell you that the patients and even the staff really enjoyed it. So let's just take a minute and look at some of these symbols and see if we can figure out what they mean, and probably without any explanation you can understand. So here we have ambulance entrance or emergency. We have financial services. We have cardiology, nurses station, family medicine. We have the chapel. We have the lab. We have the OR. We have infectious disease. We have critical care. We have this is for a meeting room where the doctor can meet with patients and family. We have second row, we have the laboratory, we have x-ray, the waiting room. Here's another one for x-ray. We have mammography. We have OB, pediatrics, orthopedics. We have the lab, and then we have pharmacy. Now you'll see that there are multiple symbols for some things, and what we did in the hospital I worked in, we put up, if there were several symbols for the same thing, we put them up in the lobby right outside the main cafeteria, and we invited patients and people walking by to look at the symbols, pick the one that they thought for each word was most descriptive, and then those were the ones that the hospital chose to use. So the citation of where you can find those symbols is at the bottom of the slide, and I would encourage you to consider using some of these universal symbols in your facility if you don't already have them. Look at this slide and think like a patient. Medical words can be puzzling to many people, not just those with limited English proficiency. Look around your clinical environment and think about the signage and words you use to label specific locations or activities that take place, and think about how you can simplify things. For example, instead of using the word radiology, use x-ray, or better yet, use the universal symbol for x-ray as a sign for radiology. Also think about words you use when talking to patients. Examples of HIV words on this slide are some of the ones that may be most puzzling. Try to reduce the use of complex medical terms like the ones above and use simpler words when possible. Remember, patients often won't tell you when they don't know what a medical word or abbreviation means, so you need to be clear with your oral communication, and you need to repeat every time you see the patient what those abbreviations mean. Don't just tell them at one visit and then assume they know. You're going to have to repeat it. Better yet, you can even make a sheet that explains those words and hand it to them so that they have it in their possession to refer to. Plain language is a term used in health literacy to denote communication that is easy to understand. The key elements of plain language are on this slide. Try to keep language at a 6th grade level or lower, and be sure any written materials have plenty of white space so the text isn't overwhelming. Test any written materials you use with actual patients. Ask them what they think. If you have the choice of several written materials, test them all. In a community project I was involved in Pennsylvania several years ago, we wanted to educate parents about dental health care for their children. We found several leaflets that we liked and held a few informal focus groups of parents to see what material they liked. They ended up choosing the one with the U.S. Department of Health and Human Services logo on it, since they felt that the government would give them correct information. Therefore, the government seal was a seal of approval. The parents were happy to help us and felt like the community had a say in the program and materials being used. The program was successful, I believe, in part because we asked the community to help with the selection of educational materials. This example can be applicable to the HIV setting as well. We want to partner with our patients and communities, and what better way than to ask community members to help develop or choose materials that will help them understand their care. Written materials are often overlooked when thinking about health literacy. How many of us in the audience today have gotten discharge instructions like these, written in small type, densely printed, and full of medical words? I bet we all have. I bet many of us also didn't read them. We probably just threw them away as useless. Look at all of the areas of your clinical setting and check that all written information intended for patients is appropriate. Get in the habit of making sure all materials are written in plain language at a 6th grade level. Written communication is also important in signage. Post signage in languages used by your patients. Don't use a lot of medical terms. Pictures help. Again, here is where your community can help you. Ask patients if signage is understandable and clear. If not, solicit suggestions. The sign in this picture could be improved by adding a picture of hands being washed so that those who may not read well can understand what the meaning of the sign is. Plain language and pictures are important in helping people understand health and the healthcare system. Think about medications. Often the name of the drug is difficult to pronounce, let alone understanding what it is for and how to take it. With this in mind, it is important to clearly communicate to patients about medications. Use pictures and short, easy-to-understand words and sentences. Think about the needs of people who may have difficulty reading or processing written words when putting such information together. This picture of one side of a medication sheet was developed by the National Health Trust in England, and it's a good example of clear communication about medications. Numeracy refers to the ability to understand and interpret numbers. This also has to do with being able to measure and/or record numerical information in a meaningful way. Many people find numbers scary and can become anxious when they have to work with numbers. This includes reading and interpreting numbers on a food package, blood pressure measurements, blood sugar, etc. When a patient needs to record specific numbers such as daily blood pressure, blood sugar numbers, calories consumed, it's important to think through how you want the records to look. Many people cannot organize numbers in a list, so making an easy-to-use chart for them to use may be helpful if you need accurate measurements. People may also have trouble with measurement, including the use of measuring cups, spoons, rulers, and the like, so it may require some teach-back if your patient needs to measure and record things as part of his care. Also, if they have to measure out liquid or draw it up into syringe, this too can be problematic. So teach-back to ensure that they know how to do this is essential. Have you ever looked at a food label and tried to figure out what all the words and numbers mean? Think about it. You walk down the breakfast cereal aisle and your senses are assaulted by a vast number of brightly colored boxes lined up on shelves. How do you know what to buy? Knowing how to read food labels is a crucial skill that isn't often taught in school or at home. Think about how mysterious such labels can be for people who have difficulty reading, who don't speak English, or are afraid of numbers. Knowing where to find key information about food nutritional value can be critical for patients with some diseases. Their health might be impacted by their ability to understand labels and select proper food. Drug labels are another mystery that people deal with on a daily basis. Think about the last over-the-counter medication you bought. Did it have a label with tiny, hard-to-see lettering on it? Was it clear what the medication was for, how to take it, and when? Was the type readable without a magnifying glass? In HIV, there can be over-the-counter medication that have interactions with HIV meds. It's important to help your patients understand the importance of communication about medications and that it is best, when possible, to use one pharmacy so that meds can be tracked and interactions more easily caught. Here is a sample prescription label. While it's clearer than most, it still contains a lot of words and abbreviations that may not be understandable to patients. This side has an example of confusing medication instructions. Take with food. What does that mean? Do I eat a cookie and then take the pill? Do I eat a meal? Why do I have to take with food? Think about instructions like this and make sure your patients know how and when to take the medications and what instructions like take with foods mean. Similarly, patients may have issues related to obtaining their meds. For example, it may be necessary to help patients decide which pharmacy to use and walk them through all the different options. Patients may worry that at the local pharmacy someone may know them and know their status just by the prescriptions that are being filled. Mail order pharmacies can be a lot more convenient, but if someone lives in a rural area, there can be challenges, particularly if they have addresses that the postman or UPS can't find, or if packages are left at the wrong address. So how do we improve health literacy? As a review, Let's take a look at this slide. Even when a patient has advanced health literacy skills, health information provided in a stressful or unfamiliar situation is unlikely to be retained. Cultural influences can also affect how people communicate and understand health information, when and from whom people seek health care, and how they respond to recommendations for lifestyle change and treatment. So what's next? Use the abbreviation KCO to think about clear communication with your patients. K, be knowledgeable. C, get comfortable. O, ask open-ended questions and use teach back to be sure patients understand. Step 1, build knowledge about HIV care, treatment, and prevention. Think about concepts and words that might be confusing for your patients and think about ways to simplify. Think about the fact that some things that are specific to HIV may be difficult for patients and even you as the provider to talk about. These include tough topics like stigma, shame, sometimes not having a support person, disclosure, and other topics. This can also include patients being asked by people who don't know their status why they go to the doctor all of the time. All of these affect HIV patients and how they receive care, and we as providers need to understand this and learn how to talk effectively and clearly and comfortably about these issues. Step 2, learn to feel comfortable talking about sensitive subjects. Be sure that your patients understand what you are saying. Think about how many words there are for vagina, penis, and sex. If you talk about sex or body parts and use anatomical words, make sure your patients know what you're talking about. Many people may not know the anatomical terms and may use slang words like PP or private parts or other words. Use pictures if necessary. Sometimes words like condom or illicit may not be part of a patient's vocabulary. They may be familiar only with slang terms. Again, be sure your patient and you both understand that you're talking about the same thing. Remember, patients often won't tell you that they don't understand because of embarrassment. It's your job to communicate effectively to be sure your patients understand about prevention and risk reduction strategies. If you use words like illicit, make sure you explain what the words mean. Use teach back to be sure your patient understands. Also remember, in some cultures, patients nod when a provider talks to them out of deference, even if they don't understand what is being said. Step 3, use plain language, open-ended questions, and teach back to ensure effective communication. Also be sure to ask about cultural beliefs and attitudes that may impact their understanding. Use pictures when possible to help with communication and use interpreters when necessary. Practice communicating clearly using role play. Use methods such as teach back and aids such as pill cards or easy to understand medication sheets and be familiar with these tools. Use pill sorting dosage containers to help patients remember when to take their pills. If patients need to record information such as blood pressure, blood sugar, or specific foods eaten, develop easy-to-use sheets for them to use to record this information. Be creative. If your patient can use a cell phone, perhaps devise a text message they can use to send in required information to their provider. Or have them put all their medication bottles in a bag and bring to the next visit. Use the pills in the bag and review together. If reading food labels for calorie or carbs is important for your patient, have him bring in some food packages and go over the labels together so that your patient understands where to find the needed information. Role play with colleagues will help you become comfortable communicating. Remember, it is best to assume that everyone will appreciate easy-to-understand communication and materials, and make that your daily practice. This resource, developed by the CDC, is an excellent guide to use in developing patient materials. You may find it necessary to develop your own materials, and this guide can help you with that. Also, always test materials with people who will be using them. Make log sheets, such as these samples, for patients to use if you want them to record information at home, such as blood pressure, blood sugar, caloric intake, etc. This pill card is another example of a communication tool that was developed by a pharmacist to assist her patients in knowing when to take medications at home. Notice the simple layout, plain language, and use of pictures to communicate about medication administration at home. Another tool to help patients manage their medications is for the clinic to obtain a pharmacy printout of medication lists and dates when the patients pick them up to help the patient manage their meds. This medication sheet, developed by the British National Health Service, is a good example of clear communication about medications. It is written in plain language and uses pictures to help convey important concepts. In HIV, it's important to know which medications patients are currently taking, as well as any HIV medications they have ever taken in the past. HIV medications can be confusing because many have up to 3 names along with some combinations. This can make it even more confusing for patients to remember the names of their medications. It's important to always communicate clearly about health topics, particularly medications. Information materials should be written in large type with pictures and written at a 6th grade level with plain language. Reinforce these materials with teachback to ensure that your patients really understand what you are telling them. Clear oral communication is also important. This matters regardless of the language a person speaks. This chart, developed by a pharmacist, gives examples of words to avoid during clinical consultations. And you'll see here that instead of using words such as condition or dysfunction, you can use things like how you feel or problem. So, spend some time looking at some of these materials that I've included in this webinar. You can get the printout and think about whether or not variations of them would be useful for you in your practice. And most importantly, remember that this is a journey. Becoming skilled in health literacy and creating an environment for your patients that is welcoming to everyone as both an organization and as individuals takes time. Also, it requires a certain amount of self-awareness and growth for our organizations and for ourselves. It has been a pleasure talking with you today about health literacy. For more information, please take a look at one of the resources above or contact me and I'll try to help you. Thank you for the important work you do caring for the health of people in your community every day. And so now we'll open it to questions.
Thank you for the wonderful presentation, Dr. Deitrick. I do have one comment. One of the participants had a comment about agreeing with the usefulness of the symbols, and because people that speak other languages oftentimes don't read English.
Well, I will tell you, Maribel, if I can, there's a citation on the bottom of that slide. There's a group called Hablamos Juntos that has spent extensive time developing these slides, and these symbols have been tested and used internationally and are being adopted around the world. So they're not something one person has developed. There's been a lot of work going into those symbols, and they're being adopted throughout the world.
Another question that we're just getting in, Dr. Deitrick, is do you have a pre and post test that we can use for our clients to test their literacy level?
No, I don't. And while there are some out there, I specifically didn't include that because I think it's better to work under the assumption that everyone needs clear, easy to understand information. If you really have a concern about a patient, you can always try the pill bottle or a pamphlet or something and ask the patient about it and see if they can read it. If you get an excuse like, I left my reading glasses home, or they look at it and seem puzzled, I think that's going to be adequate. But it's really better not to label patients as low literacy. It's really better to just make everything clear and plain language and easy to understand.
Another question, Dr. Deitrick, is there are some organizations that have quality improvement objectives, how would you recommend that they have a measurable goal when they're trying to improve health literacy for patients? What kind of a goal would be one that is measurable?
Well, there are some surveys, particularly the CAPS survey if you work in the outpatient setting and the HCAP survey if you work in the hospital setting, that measure patient satisfaction with care. And there are custom questions that can be added to each of those surveys to really hone in on specific things that your organization or agency may want to deal with. Also, you can like if you're going to do something with wayfinding, walk through with the community, make some changes, and then get the same group of people to walk through and ask them whether or not they feel it's an improvement.
Okay. We have another question from a participant who's English speaking only. And this participant, it says that he works a lot with Hispanic and Haitian Creole speaking patients. And how or where can I learn more about the cultural differences of these populations?
Well, I've done several webinars on those, and there are a lot of places. There's a site called Diversity RX that does have health information. There's a lot of stuff out there on the internet, or if you contact me offline, I'll be happy to point you in the direct location. And how do you, I see one about engaging a patient in health literacy without being offensive. All you're going to do is work it into your normal interaction. You know, maybe say something like, you know, as part of our visit today, I wanted to go over your medications. Can you, here's a pill bottle. You know, I want to make sure you understand your meds. Can you look at the pill bottle and tell me what needs to be clarified, or something like that. But it's really important not to necessarily label people as having low health literacy. I think it's better to just, you know, use the methodology on everyone. Everyone can benefit from teachback. I mean, I'm an RN and have a Ph.D., but I'll tell you, when I'm a patient, I get nervous, and sometimes I don't hear and listen as clearly as I should just because of being nervous. So I think it's better to get into the frame of mind of not labeling people, but just developing a plan that you're going to work with everybody. You're going to make all your materials a plain language, 6th grade level, and just work with everyone that way, regardless.
One more question coming up. It says bliss symbols were developed for the non-oral population. Some of the symbols we are using remind me of bliss symbols. So I think that's more of a comment. I don't know if you want to add to that.
No, I think that's a very good point. And it also reminds me to remind you that, you know, a picture speaks 1,000 words. So, you know, if you have pictures of body parts, of different pills, anything in pictures or that will help make things clearer are very useful. You know, people who are hearing impaired, there's picture charts that we often use in the hospital setting. And I think that that's something you want to think about too. So health literacy also includes the hearing impaired, the visually impaired, all of those things.
The Florida Caribbean AIDS Education and Training Center's mission is to ensure that physicians, nurses, nurse practitioners, physician assistants, dentists, pharmacists, case managers, and other healthcare professionals in Florida, Puerto Rico, and the U.S. Virgin Islands receive state-of-the-art information, training, and consultation on the prevention, chronic disease management, and treatment of HIV and AIDS. Funding is provided by the HIV/AIDS Bureau of the Health Resources Services Administration, U.S. Department of Health and Human Services. The Florida Caribbean AIDS Education and Training Center provides a variety of HIV/AIDS education, training, consultation, and resources. Visit our website, www.fcaetc.org, to learn more. Stay in touch with us by joining our mailing and email list. You will receive notices about upcoming educational opportunities as well as new and updated HIV/AIDS resources. You may also sign up to receive our HIV CareLink newsletter. Visit our website, fcaetc.org, and click on Join Our Mailing and Email List at the top of the homepage. Be sure to also connect with us on Facebook, Twitter, LinkedIn, and YouTube. The Florida Caribbean AETC provides consultation services to clinicians in Florida, Puerto Rico, and the U.S. Virgin Islands. If you have questions related to the content of this program or would like consultation on the diagnosis, prevention, and treatment of HIV/AIDS and related conditions, we would love to hear from you. We also offer consultation on the interpretation of resistance test results. Visit www.fcaetc.org/consultation to ask your question today. The Florida Caribbean AIDS Education and Training Center provides pocket-sized treatment guideline resources that detail the federally approved HIV/AIDS medical practice guidelines, such as the adult antiretroviral therapy, hepatitis, pediatric antiretroviral therapy, adult opportunistic infections, tuberculosis, and pre-exposure prophylaxis, non-occupational post-exposure prophylaxis, and occupational PEP. In addition, we have summarized common practices for the post-exposure prophylaxis in pediatrics adolescents. We have also developed resources that provide an overview for treatment of sexually transmitted diseases in HIV-infected patients and therapeutic agents for oral manifestations. Visit our website to download or request copies of these resources. The Florida Caribbean AIDS Education and Training Center provides web-based educational opportunities to increase the knowledge and skills of HIV healthcare providers. Live and on-demand options are available. Visit www.fcaetc.org/education for more information. Florida Caribbean AIDS Education and Training Center, Project ECHO, provides a web-based didactic presentation on a current HIV treatment issue based upon current Department of Health and Human Services and other accepted treatment guidelines. Project ECHO also provides an opportunity to discuss case presentations submitted by participants and an opportunity to network with both your peers and HIV experts. All members of care and treatment teams, including case managers, are welcome to participate. Information discussed is targeted at providers with basic or intermediate HIV/AIDS treatment experience. Choose from 4 session types. Visit www.fcaetc.org/echo to view upcoming sessions and to register. If you're located outside of our region, the Clinician Consultation Center provides consultation services via the phone numbers listed here. Or you may also visit www.nccc.ucsf.edu for more information. To locate the AETC in your region, visit www.aidsetc.org.